Good afternoon and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey.
Advances in technology, especially when it comes to medicine, can literally change a person's life overnight. Today we are taking a look at how the Hair Restoration Center at Charleston Plastic Surgery is using a new robotic procedure to help those suffering from hair loss, which according to the American Academy of Dermatology impacts some 80 million men and women across the U.S. each and every year.
Joining us today, we have Dr. Patrick Angelos. We're here at the Hair Restoration Center at Charleston Plastic Surgery. Thank you so much for having us today.
Absolutely. Thank you for coming.
Okay, so I'm super excited because you're bringing some big news to the Low Country, a new procedure when it comes to hair loss. Tell us about it.
Right. We're really excited as well. We're offering robotic hair restoration. We're the first in the Carolinas to offer the latest Artis IX system for robotic hair transplantation.
Okay, so how does it actually work?
That's a really good question. It's a physician-assisted robotic technology that actually uses artificial intelligence and uses its stereoscopic vision system married to its very sophisticated computer software to harvest very healthy grafts for transplantation by being minimally invasive. And in turn, that leads to a very quick and easy recovery for patients with very natural, lasting, permanent results.
Okay, so I gotta break this down. So are you going through the head and finding a good, you're that's a good piece of hair, and then how do you take it out and
So basically in hair transplantation, there's three main steps. There's harvesting hair from the back and the sides.
So does that mean growing it, or
No,
harvesting?
That's basically extracting hair follicles out of the scalp.
And moving them?
In a patient who is bald on top, the hair that's on the sides and the back will live permanently if transplanted up to the top. So we use the robot for harvesting grafts along the back and the side, and then we transplant those up to the top where they'll live permanently.
Isn't it crazy how robotics is really, when it comes to medicine, really playing a huge role these days, right?
Absolutely. We're very fortunate to be able to take advantage of all the benefits that the robot has to offer as far as being very precise and very accurate on the first graft, as well as if we're doing a case that has 2,000 grafts, it's just as precise and accurate at 2,000 grafts as it is the first, as compared to a human trying to, by hand harvest the grafts. A lot more room for error and destruction of the surrounding hair follicles, which can actually lead to problems like over-harvesting of hair in the back that could be noticeable. So this leaves very minimal, typically not noticeable scarring, and like I said, very quick and easy recovery for the patient.
You said non-invasive. Does that mean, do they go under anesthesia? I
wouldn't say it's non-invasive, more minimally invasive.
Okay, there we go.
It is done outpatient. It's done under local anesthesia with a little bit of relaxing medication by mouth.
So does that mean they're awake during it?
They're awake during the procedure. It takes most of the day in the office, obviously depending on how big the case is, the number of grafts, etc.
Okay, so you've been doing this a long time, surgeon. So is it easier for you to do the procedure? Is it really helping you have better results?
One of the biggest advantages I would say with using the robot to take some of the tediousness out of it, I can focus more on things that are really important to the patient as far as designing the hairline.
Like placement and things?
Exactly. So how we place the grafts, design the hairline to make sure it looks natural now, and also 20 plus years from now in the future, we be able to spend more time with the patients, making sure they're comfortable throughout the procedure with local anesthesia, etc. So it really, kind of frees us up to do more and take better care of the patients, in my opinion.
And I think a lot of times when we think about hair loss, we think about men primarily.
Correct.
Right? And so this is also open up to the ladies as well, right?
Absolutely. Across the country, probably 15% or so of hair transplants are women. So obviously majority are men with male pattern baldness, but this does affect women as well, and some women are interested in having the procedure done as well.
Okay, and just real quick, as far as the causes of hair loss, to kind of, for the folks at home who may not know a lot about why it happens.
Sure, so there's many different causes of hair loss. The majority of what we're treating is called androgenic alopecia, or what's commonly referred to as male pattern baldness. Those are the typically the best candidates for hair transplantation. But there are other, medical causes, including, scalp conditions, thyroid conditions, anemia, other things that can cause hair loss, and we tend to treat those more medically. Now, we're a full hair restoration center. Not only do we do hair transplantation surgery, we also offer a host of medical treatments that include topical medications, oral medications, laser caps for regrowing hair, as well as PRP injections, that stands for platelet-rich plasma, and we offer all of that as well.
And those are all options that you look at when you're talking to your patients and making sure that you have the right solution.
So we try to take each patient on a case-by-case basis, because everybody's situation is unique and different. We tailor the treatment recommendations per the patient and their situation, where they are at their point of hair loss, because typically it's a progressive problem.
Well, I have to say this, you have fantastic hair, by the way.
Thank you so much.
Well, anyway, let's actually go hear from one of your patients who is going to kind of give us their story as to why they decided to do this.
Great.
I wake up every morning and look at myself in the mirror and see, the receding hairline and the hair moving back, and it makes me feel older, and so I want to try to slow that process down and bring some youthfulness back into how I feel and how I look. I knew 14 years ago this was probably something I was going to have to do again, but honestly, after going through the process of the strip, it was really something that I wouldn't consider doing again. I wasn't going to do again because, quite honestly, it's brutal. It wasn't until I started hearing a little bit about the robotic procedures that I started to investigate a little bit. After learning how they do the procedure now, which is seamlessly pain-free for the patient, there isn't the huge lineal scar that you had before, the recovery time of that, and really how precise the machine is, really kind of drew me back into going, okay, this is something I can do again. This is something I want to do again to help maintain the hair in my youthful appearance. Dr. Angelos was amazing. He makes you feel so comfortable even the first time that you get to meet and have a conversation with him. The explanation of exactly what he was going to do was straightforward to where I could understand it. And because I'd been through it before, it was comfort in knowing how he was going to do it.
For more information, visit getmorehaircharleston.com.